Welcome to the Windsor-Essex County Health Unit's COVID-19 Emergency Food Service training video for staff, volunteers, and truck operators working in emergency food service. Please note that the information in this training is current as of Monday, March 30th, 2020. Please visit our website for the most up-to-date information. In this video, you will learn about COVID-19 and how to keep yourself and others safe during this or any other pandemic. As a volunteer, staff member, or truck operator, your commitment to helping others in need is important and invaluable. We are truly grateful for your role in helping to ensure those in need of food and other supplies continue to have access during this uncertain time. Now let's take a look at what we will cover in this video. In this training, we will discuss what COVID-19 is, why it is a concern, a screening tool for staff and volunteers, and safety protocols for everyone working within your facility. This includes staff, volunteers, and truck operators. It is important for you to understand some general information on how to keep safe while assisting during the COVID-19 or any other pandemic. You will also learn how you can keep yourself and others safe during food delivery services and if and when clients pick food up. COVID-19 is a type of coronavirus. Coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe disease. COVID-19 is different from the other types of coronaviruses. It was first identified in Wuhan, China, and was declared a pandemic by the World Health Organization on March 11, 2020. The virus that causes COVID-19 seems to be spreading easily. The virus can spread from person to person or from contact with contaminated surfaces or objects. Symptoms of COVID-19 range from mild to severe respiratory illness, including fever, cough, difficulty breathing, and pneumonia. Have volunteers complete the self-assessment tool on the Government of Ontario website prior to putting their names forward, especially if their roles involve interacting with others. Screen staff and volunteers for COVID-19 when they arrive for their scheduled shift by asking the following questions. Do you have a fever, a new or existing cough, or difficulty breathing? Have you traveled outside Canada in the last 14 days? Have you been in close contact with someone who has been tested positive or is awaiting results for COVID-19? Have you been in close contact with a person with acute respiratory illness who has traveled outside Canada in the last 14 days? If they answer yes to any of these questions, ask them to self-isolate for 14 days and contact their primary healthcare provider or Telehealth Ontario at 1-866-797-0000. When you are asked to self-isolate, it means to separate yourself from others, including the people you live with and others in the community, for 14 days. Self-isolating will help you to prevent spreading the virus to others. For detailed information on self-isolating, visit wechu.org/cv/protectyourself. Any staff or volunteers that are over 70 years of age or individuals who are immunocompromised because of existing health issues should not be involved in food distribution at this time. If these individuals still wish to contribute to the program, consider providing tasks that can be done from home, such as scheduling pickups, scheduling deliveries, or soliciting donations. Social distancing is important during this uncertain time. This means minimizing any close contact and keeping a distance of at least 2 meters from others at all times. Limit the number of staff and volunteers that are allowed in the working space at one time. Workstations should be kept a minimum of 2 meters apart. This distance should be kept while moving about throughout the facility. Stagger the hours of work if possible for staff and volunteers. This can help to limit the number of people in one place at a time. Use physical barriers to control the flow of people both inside and outside of your facility, to physically prevent clients from getting too close to staff and volunteers. Examples of physical barriers include tables, desks, ropes, or stanchions. Ensure that COVID-19 prevention signage and hand washing signage is posted throughout the facilities. Visit weechu.org/cv/workplaces to find the Government of Ontario COVID-19 Best Practice poster, as well as the Weechu hand washing poster under the resource section of our website. Ensure that staff and volunteers practice proper hand hygiene regularly. Wash hands with soap and warm water for at least 20 seconds, or if hand washing facilities are not readily available, use an alcohol-based hand sanitizer with at least 70% alcohol. Hands are to be washed before and after preparing food, after handling food and food packaging, after touching your face, after coughing or sneezing into a tissue or your elbow, after touching common surfaces, any other time that you would normally wash your hands. Ensure that you have sufficient hand washing stations and/or hand sanitizing stations with hand sanitizer containing at least 70% alcohol. Ensure these stations are kept full. Ensure there are hand washing or hand sanitizer stations at all locations where staff and volunteers change tasks or handle things. All volunteers should use a tissue when coughing, sneezing, or blowing their nose. Always throw used tissue in the garbage. Cough or sneeze into your upper sleeve or elbow if you do not have a tissue. After coughing, sneezing, or blowing your nose, wash your hands using warm water and soap or an alcohol-based hand sanitizer. Increase cleaning and sanitization practices, especially in high-traffic areas. Frequently touched surfaces, such as those that contact food, handles, doorknobs, tables, light switches, toilets, and railings need a thorough cleaning at least twice a day and when visibly dirty. For more information about cleaning and disinfection in public places and workplaces, visit weechu.org/cv/workplaces. All drivers, volunteers, and staff should practice regular hand hygiene. This means hand washing with soap and warm water for at least 20 seconds or using an alcohol-based hand sanitizer if a hand washing station is unavailable. Keep a social distance from others of at least 2 meters when receiving or providing food donations. All drivers should use a tissue when coughing, sneezing, or blowing their nose. Always throw used tissue in the garbage. Cough or sneeze into your upper sleeve or elbow if you do not have a tissue. After coughing, sneezing, or blowing your nose, wash your hands using warm water and soap or an alcohol-based hand sanitizer. Be sure to carry an alcohol-based hand sanitizer with you in your vehicle, as soap and water will not be readily available in many instances. When unloading food donations from a truck with other staff or volunteers, be sure to place food donations on the edge of the truck, keeping at least a 2-meter distance from it. Try not to pass the food donations directly to staff or volunteers by hand. Make sure your truck is equipped with items that help you stay safe during this time. These items include alcohol-based hand sanitizer, disinfectant wipes or spray with paper towel, facial tissues, trash bag. You need to use these items before and after each delivery and pickup, and discard the trash bag at the end of your shift. Physical distancing is important. This means minimizing close contact with others. Therefore, when using the delivery truck or vehicle, it should only be occupied by one person at a time. When unloading food donations from a truck with truck operators or drivers, be sure to collect food donations from the edge of the truck and wait until the driver-operator has placed the goods down and moved away from the donations to help keep at least a 2-meter distance from others. If working with others, practice social distancing by keeping at least 2 meters between you and your coworkers, and try not to pass food donations directly to others by hand. When delivering food to someone's home, call in advance to notify them of the time of delivery. Let clients know you will be leaving the food for them at their front door. Knock loudly or ring the doorbell and leave the food in front of their door. Wait in your vehicle until the person picks up their food. If it is an apartment building with a secure entrance, ring the buzzer to let the person know that their food is in the lobby and that you will be waiting in your vehicle until they come down and get it. If they are unable to come down to the lobby, ask to be buzzed in, leave the food donation at their door, and knock to let them know it is there. When you return to your vehicle, always sanitize your hands with an alcohol-based hand sanitizer containing a minimum of 70% alcohol. If delivering food to individuals in any other circumstance, such as those without a residence, stay at least 2 meters from those receiving the donation. Wash your hands with soap and water or sanitize your hands with an alcohol-based hand sanitizer after each interaction. For individuals who are coming to pick up their food, have them take the self-assessment at ontario.ca to determine if they can attend a pickup location. This will allow anyone not passing the self-assessment screen to arrange for an alternate pickup person or to schedule a delivery. Screen individuals for COVID-19 before they enter the facility by asking the following questions. Do you have a fever, new or existing cough, or difficulty breathing? Have you traveled outside Canada in the last 14 days? Have you been in close contact with someone who has been tested positive or is awaiting results for COVID-19? Have you been in close contact with a person with acute respiratory illness who has traveled outside Canada in the last 14 days? If they answer yes to any of these questions, ask them to self-isolate for 14 days and contact their primary healthcare provider or Telehealth Ontario at 1-866-797-0000. Let them know that other arrangements can be made for their food pickup. Limit the number of individuals inside your facility at any given time. Ensure that your facility allows for adequate social distancing. That is, a minimum of 2 meters between people, including those working, volunteering, and those waiting in line. Have takeaway food boxes and bagged meals prepared ahead of time so that they can be taken away without the individual having to enter your facility. These should be labeled and left in an area separate from the people coming in to pick up their food. Minimize gathering of clients by scheduling staggered client pickups and/or extending program hours. If capacity exists, consider requiring clients to call ahead to indicate their need and arrange for a pickup or delivery. If possible, consider providing a greater quantity of food to reduce the frequency of visits. Ensure all staff and volunteers self-assess on a daily basis prior to arriving at your facility. If they answer yes to any self-assessment questions, they should stay home, self-isolate for 14 days, and contact their healthcare provider or Telehealth Ontario at 1-866-797-0000 for further direction. If at any time you have additional questions or concerns, please visit the Windsor-Essex County Health Unit's website at wechu.org.